Hello, I'm Dr. Sanjeev Gulati, Director Nephrology and Kidney Transplant, Fortis Group of Hospitals, NCR. As you all know, we are going through a second phase of the COVID pandemic. And today I'll be sharing with you 7 tips for managing COVID in kidney patients. First, get yourself vaccinated as well as all your family members. Vaccine is the best protection against severe COVID disease. If you are vaccinated, COVID is reduced to a common flu. You'll just get mild aches and pains, a bit of fever, but most of you will recover. Our experience has been that those people who did not get vaccinated, and this includes some of the doctors also, had very severe disease and ended up either in the ICU, or some of them we also could not save them. So once again, if you are not vaccinated, please register yourself and all your family members and complete the 2-dose vaccination schedule. You might get a bit of fever and a body ache after vaccine, but that is quite expected. You cannot get COVID infection from the vaccine. Second, even after vaccination, you have to practice SMS. S is for sanitization, M is for mask, and S is for social distancing. The protection from even 2 doses of vaccine is not absolute. You can still get infection. Yes, you might get a mild disease, but a vaccine doesn't completely protect you from an infection, especially because there are newer mutant strains that are coming. So remember SMS, you have to practice that. You cannot do away without masks, social distancing, sanitization. Third, if you develop some symptoms like fever, headache, extreme weakness, diarrhea, or a pain in the throat, sore throat, immediately get yourself tested, preferably with an COVID RT-PCR or a rapid antigen test. But even if you have a rapid antigen test which is negative, it doesn't preclude you that you don't have COVID. Yes, if the rapid antigen is positive, it does confirm a diagnosis of COVID. So time and again it has been shown that early diagnosis is the key, not only to optimal management but also to prevent spread of infection to your family members. Fourth, even if the COVID test turns out to be positive, do not panic. COVID is just like another flu. So if you are able to diagnose it in early and you are able to isolate yourself, make sure you stay well hydrated, take plenty of hot fluids and steam, especially because in the first 5 days the virus is active in the body. At that point of time, it has been shown that if you do steam inhalation, it kills the virus in the oral nasopharyngeal cavity. If you take a lot of fluids, again hot fluids, you'll be able to swallow down the virus into your stomach. You can also do some betadine gargles, and all these 3 measures will help in reducing the virus load. Fifth, immediately take a consultation from an expert the moment you become positive. Whatever you may have read in Google or in books or from your family members, there is no substitute for an expert. We have been all of us have had experience of managing thousands of patients with COVID, and we can tell you the do's and don'ts most effectively. Even if you don't even have to go to a hospital, this advice is now available on online consultation or a teleconsultation. You can immediately book a teleconsultation and you have the advantage of getting an expert advice from the safety of your home. Sixth, yes, once you have confirmed COVID, some home monitoring is mandatory. You need to monitor your temperature, but don't panic if you do have fever, because fever is a natural defense mechanism against any infection. Remember how if the water is dirty, we are not sure that it is clean, we boil it because it destroys all the bacteria or viruses. Similarly, the body also raises its temperature to destroy the virus. So don't get afraid of fever. Yes, if the fever is very high, say it's touching 101, you can take a paracetamol. The second most important thing to do is that make sure you take plenty of fluids and stay well hydrated, and also have good nutrition, because hydration as well as nutrition are your best defenses against fighting any viral infection, and this is also true for COVID. Third is get hold of a pulse oximeter and monitor your oxygen saturation. We recommend that the oxygen saturation should stay above 94. There's another way to monitor oxygen saturation, and that is to do a 6-minute walk test, which means that you plug in this pulse oximeter, take a baseline reading, do a walk for 6 minutes, and again take a repeat reading. If your pulse oximeter values stay high, stay in the same range of 94, 95, you don't need to panic. There is no point in getting a CT scan or getting expensive tests. You need to provide the temperature values, the oxygen saturation values to the doctor, so that we can separate out patients who can be managed safely at home, which is the vast majority. At the same time, we can prioritize those patients who are not well for admission. Seventh, hospitalization again is required for a very few of these patients. The most important indicator for getting to a hospital or requesting for hospital admission is low oxygen saturation. So if your oxygen saturation starts dipping, immediately get in touch with the doctor and request him for admission. Another thing that you can do while we are waiting for admission is to lie in a prone position on your stomach. That will help improve the oxygen values. Also make sure that you don't get dehydrated, because high fever leads to a lot of water losses. So in the interim, while we are waiting for a hospital bed, take plenty of fluids. And if your oxygen is dipping down, you're not getting a bed, again you can get some oxygen at home through an oxygen concentrator or a cylinder and inhale oxygen, and at the same time continue your therapy as well as monitoring under an expert doctor, so that the treatment is not delayed. We have during this current pandemic, we have managed even severe cases of COVID at home who could not get a bed, and we have given them medications like ivermectin, doxycycline, paracetamol, and steroids, especially after 7 to 8 days. Steroids are a great lifesavers. Several studies have shown that steroids save life, but all this should be done under an expert supervision, not under the advice of your relatives, friends, or Google. So if you follow all these 7 tips, I can assure you that the vast majority, 99% of you all will get better with this therapy at home. Yes, there is 1% of these patients who, because of their immune status, would require hospital admission. But these tips help us to separate out these patients. Thank you.